If you've been tossing garlic into your meals without understanding what it's actually doing inside your body, what I'm about to share might completely change how you see this ancient ingredient. Last month, I had a 72-year-old patient walk into my office with lab results that shocked both of us, and the only significant change she'd made to her routine was adding one simple thing to her breakfast every single morning. What happened next challenged everything she thought she knew about her health. My name is Dr. Susan Miller, and I've been working as an internal medicine physician for over 18 years. Throughout my career, I've witnessed countless patients struggle with preventable health issues, and I've also seen remarkable transformations when people make informed decisions about what they put into their bodies. Today, I want to talk about something that's been used medicinally for thousands of years, but is often misunderstood in modern times. Before we dive in, if you haven't subscribed yet, I highly recommend hitting that subscribe button and turning on notifications so you never miss another health tip made especially for you. If you enjoy this video, please leave your questions and video suggestions in the comments below. I read every single one, and it helps me create more content to help people just like you. Now, let's talk about what really happens inside your body when you consume one garlic clove daily. I'm not here to make exaggerated claims or promise miracle cures. What I want to do is walk you through the actual biological mechanisms, share real experiences from my clinical practice, and give you the information you need to make educated decisions about your own health. When you bite into a raw garlic clove or even cook it lightly, you're releasing a compound called allicin. This is where the magic begins. Allicin is a sulfur-containing compound that forms when garlic is crushed or chopped, and it's responsible for both garlic's distinctive smell and many of its biological effects. Once this compound enters your digestive system, it doesn't just pass through unchanged. Your body begins breaking it down into various sulfur compounds that can cross into your bloodstream and reach different organs and tissues throughout your entire body. Let me tell you about Mrs. Helena Rodriguez, a 68-year-old retired teacher from Porto Alegre who came to see me about 3 years ago. Helena had spent her entire career dedicated to educating children, always putting others first and often neglecting her own health. When she finally retired, her daughter convinced her to get a complete health checkup. The results weren't terrible, but they weren't great either. Her cholesterol levels were creeping into the concerning range, her blood pressure was borderline high, and she was feeling constantly tired despite getting adequate sleep. Helena was terrified of starting medication. She'd seen her own mother struggle with multiple prescriptions and their side effects, and she desperately wanted to avoid that path if possible. During our conversation, I mentioned that while medication might eventually become necessary, there were several lifestyle modifications we could try first. She asked me about natural approaches she'd heard about, and garlic came up. I explained that while garlic wasn't a magic bullet, research had shown some promising effects on cardiovascular health. Helena decided to commit to eating one raw garlic clove every morning, mixed into her breakfast of whole grain toast with avocado. She also made other changes, walking 30 minutes daily and reducing her processed food intake. But the garlic became her consistent daily ritual. 6 months later, when she returned for follow-up labs, her LDL cholesterol had dropped by 23 points, and her blood pressure had normalized. Was it just the garlic? Probably not entirely. But was the garlic a contributing factor? Based on what we know about its mechanisms, absolutely. If you're still watching and finding this information valuable, comment 1 below to show me you're with me. Now, what exactly was happening inside Helena's body? When you consume garlic regularly, the sulfur compounds begin to interact with the cells that line your blood vessels, called endothelial cells. These compounds trigger the production of nitric oxide, a molecule that acts as a natural vasodilator. Think of your blood vessels like flexible tubes. When they're stiff and constricted, your heart has to work much harder to push blood through them. Nitric oxide helps these vessels relax and widen, reducing the pressure needed to circulate blood throughout your body. But here's something most people don't realize. The effect isn't immediate or dramatic. You won't eat garlic today, and see your blood pressure plummet tomorrow. The benefits accumulate gradually over weeks and months of consistent use. This is why so many people give up too soon or dismiss garlic's potential benefits entirely. They're expecting overnight results from something that works through subtle, cumulative changes at the cellular level. Beyond cardiovascular effects, garlic has remarkable antimicrobial properties that have fascinated me throughout my career. And I don't just mean fighting off the common cold, though that's part of it. The compounds in garlic can inhibit the growth of various bacteria, fungi, and even some viruses. This doesn't mean garlic can replace antibiotics or antiviral medications when you have a serious infection. But it does suggest that regular garlic consumption might help your body maintain a more robust defense system against everyday pathogens. Let me share another case with you, one that really opened my eyes to garlic's broader potential. Mr. Carlos Mendez, a 74-year-old retired mechanic from Curitiba, came to my office with recurring fungal infections on his toenails. This might sound like a minor issue, but for Carlos, it had become a source of constant discomfort and embarrassment. He loved going to the beach with his grandchildren, but he'd stopped because he was self-conscious about his feet. Carlos had tried over-the-counter antifungal creams with limited success. The prescription oral medications were an option, but they required monitoring liver function and came with potential side effects that concerned him, especially since he was already taking medications for his diabetes. During our discussion about alternative approaches, I mentioned that garlic had demonstrated antifungal properties in various studies. I suggested he try a two-pronged approach, applying crushed garlic topically to the affected nails for short periods under supervision, and consuming one garlic clove daily to potentially support his immune system from the inside. Carlos was skeptical, but willing to try anything. He followed the protocol diligently for 4 months. The topical application wasn't pleasant, he admitted, but he persisted. Gradually, the new nail growth started coming in clear and healthy. His fungal infection didn't disappear overnight, but by the 6-month mark, his toenails looked better than they had in years. He sent me a photo of himself at the beach with his grandchildren, barefoot in the sand, with a message that simply said, "Thank you for giving me back my confidence." Now, I need to emphasize something crucial here. Carlos's success involved multiple factors, including improved blood sugar control and better foot hygiene. The garlic was one component of a comprehensive approach. This is important because I never want anyone thinking that garlic alone can cure complex health conditions. What it can do is support your body's natural processes when combined with other healthy practices. But if that surprised you, wait until you hear about garlic's potential impact on cognitive health. This is an area that doesn't get discussed nearly enough, and it's especially relevant for anyone concerned about maintaining mental sharpness as they age. Your brain is incredibly vulnerable to oxidative stress. Every day, your cells produce free radicals as a natural byproduct of metabolism. These unstable molecules can damage cellular structures, including the delicate neurons in your brain. Over time, this oxidative damage accumulates and contributes to cognitive decline. Now, your body has natural antioxidant defenses, but they can become overwhelmed, especially as you age or if you're exposed to additional stressors like poor diet, lack of sleep, or chronic inflammation. Garlic contains powerful antioxidant compounds that can help neutralize these free radicals. But it does something even more interesting. The sulfur compounds in garlic can actually stimulate your body's own production of antioxidant enzymes. It's like teaching your cells to better defend themselves rather than just providing external protection. This two-pronged antioxidant effect is one reason researchers have become increasingly interested in garlic's potential neuroprotective properties. Mrs. Beatriz Santos, an 81-year-old former librarian from Florianopolis, came to see me accompanied by her concerned daughter. Beatriz had been experiencing what she described as mental fog for several months. She was forgetting appointments, losing track of conversations, and feeling increasingly frustrated with her declining memory. Her daughter feared it might be the beginning of dementia. We ran comprehensive tests to rule out other causes like vitamin deficiencies, thyroid problems, or medication side effects. Everything came back within normal ranges, which was actually good news, but didn't explain her symptoms. I suspected her issues might be related to reduced blood flow to the brain and increased oxidative stress, both common in aging. We discussed various approaches, and Beatrice, who had always been interested in natural remedies, asked specifically about foods that might support brain health. I explained that while no single food could prevent cognitive decline, certain dietary patterns had shown promise in research. Garlic was among the foods I mentioned, along with fatty fish, berries, and leafy greens. Beatrice committed to what she called her brain-healthy routine, which included 1 garlic clove every morning mixed into her breakfast omelet, regular walks, staying socially engaged, and doing crossword puzzles daily. Over the next 4 months, something remarkable happened. Beatrice reported feeling mentally clearer. She was remembering appointments without checking her calendar multiple times. Her daughter confirmed that she seemed more like her old self, sharper and more engaged in conversations. During our follow-up visit, Beatrice told me something that stuck with me. She said, "Dr. Susan, I don't know if it's the garlic specifically or the whole routine, but for the first time in months, I feel like myself again. I feel like I have my mind back." Could we definitively say the garlic was responsible for her improvement? No, because she'd made multiple changes simultaneously. But based on what we understand about garlic's effects on circulation and oxidative stress, it was very likely a contributing factor to her cognitive improvements. Now let's talk about something that affects millions of people, but often goes unaddressed until it becomes serious: chronic inflammation. You've probably heard inflammation discussed as though it's always bad, but that's not entirely accurate. Acute inflammation, the kind you get when you cut your finger or catch a cold, is actually your immune system doing its job, fighting off threats and promoting healing. The problem is chronic low-grade inflammation that persists for months or years without resolution. This type of inflammation doesn't cause obvious symptoms at first. You won't necessarily feel it, but over time, it contributes to a staggering array of health problems: cardiovascular disease, diabetes, arthritis, and even certain cancers. When researchers look at people with these conditions, they consistently find elevated markers of inflammation in their blood. This has led to a growing recognition that managing inflammation might be one of the most important things we can do for long-term health. Garlic's anti-inflammatory effects work through multiple pathways. The sulfur compounds can inhibit certain enzymes involved in producing inflammatory molecules. They can also influence the activity of immune cells, helping to calm overactive immune responses that drive chronic inflammation. Again, this isn't an instant effect. You can't eat garlic today and expect all your inflammation markers to normalize tomorrow, but consistent consumption over time can contribute to lower overall inflammatory burden. Mr. Antonio Silva, a 65-year-old former construction worker from Belo Horizonte, had been dealing with knee pain for years. The decades of physical labor had taken their toll, and his doctor had suggested he might eventually need knee replacement surgery. Antonio had already tried physical therapy, lost weight, and was taking anti-inflammatory medication when needed. But the pain was constant and limiting his activities. Antonio was a proud man who had worked with his hands his entire life. The idea of being unable to play with his grandchildren or work in his vegetable garden devastated him. During one of our conversations, he mentioned he'd heard something about anti-inflammatory foods and wanted to know if they could possibly help. I explained that while diet alone couldn't reverse joint damage, certain foods might help manage inflammation and potentially reduce his discomfort levels. We discussed adding several anti-inflammatory foods to his diet, and garlic was high on the list. Antonio started including fresh garlic in virtually every meal. He'd crush it and let it sit for 10 minutes before cooking to maximize allicin formation, something I'd explained helped preserve its beneficial compounds. He continued his other treatments as well, not replacing anything but adding this dietary component. 3 months later, Antonio reported something unexpected. He said his baseline pain level had decreased noticeably. He wasn't pain-free by any means, but he'd been able to reduce his anti-inflammatory medication slightly with his doctor's approval. More importantly to him, he was able to spend longer periods working in his garden and playing with his grandchildren without needing to rest. He told me, "Doctor, I don't know if it's in my head or if this garlic thing really works, but I'm taking less medication and doing more activities than I was 6 months ago. That's all the proof I need." The skeptical part of me, the scientific part, knows we can't attribute all of Antonio's improvements solely to garlic. But the clinician in me, who's seen similar patterns in multiple patients, believes the garlic was genuinely contributing to his reduced inflammatory burden and improved quality of life. If you're finding this information helpful and want to see more content like this, please consider liking this video. It really helps me reach more people who might benefit from this information. Now, I need to address something important about garlic and blood sugar regulation, especially for anyone dealing with diabetes or prediabetes. This is an area where I've seen garlic make a measurable difference in some patients, and it's backed by some interesting research into the mechanisms involved. When you eat carbohydrates, your body breaks them down into glucose, which enters your bloodstream. Your pancreas responds by releasing insulin, a hormone that helps move glucose from your blood into your cells, where it can be used for energy. In people with insulin resistance or diabetes, this system doesn't work efficiently. Either the pancreas doesn't produce enough insulin, or the body's cells don't respond properly to the insulin that's there. This leads to elevated blood sugar levels, which over time can damage blood vessels, nerves, and organs throughout the body. Research has suggested that garlic may help improve insulin sensitivity, meaning it helps your cells respond better to insulin signals. The exact mechanisms aren't fully understood, but it appears that the sulfur compounds in garlic can influence certain cellular pathways involved in glucose metabolism. Additionally, garlic seems to have a modest effect on fasting blood sugar levels when consumed regularly over several weeks or months. Mrs. Mariana Costa, a 70-year-old retired nurse from Salvador, had been diagnosed with type 2 diabetes about 5 years before she became my patient. She'd managed it reasonably well with medication and diet modifications, but her morning fasting blood sugar levels had been creeping upward despite her best efforts. She was frustrated because she felt she was doing everything right, eating carefully and exercising regularly, yet her numbers weren't reflecting her efforts. Mariana had spent her career caring for others and knew the serious complications that uncontrolled diabetes could cause. She was determined not to let her condition progress. During one of our appointments, she asked if there were any dietary additions that might help, anything she hadn't tried yet. I mentioned that some studies had shown garlic consumption was associated with modest improvements in blood sugar control in diabetic patients. Mariana, with her medical background, wanted to see actual results, so we agreed to monitor her closely. She started eating 1 garlic clove every morning, crushed and mixed into her breakfast. She changed nothing else about her medication or routine. We checked her fasting blood sugar weekly for the first month, then every 2 weeks after that. The results weren't dramatic, but they were consistent. Her average fasting blood sugar gradually decreased by about 12 to 15 points over 3 months. Her hemoglobin A1C, which measures average blood sugar over 3 months, improved from 7.4% to 6.9%. These might seem like small numbers, but in diabetes management, they're significant. She was thrilled, not because garlic had cured her diabetes, which it hadn't, but because this simple addition had helped her achieve better control. Mariana later told me, "As a nurse, I spent years telling patients that small, consistent changes matter more than dramatic overhauls. Now, I'm living proof of my own advice. This tiny clove of garlic, eaten daily, helped me get my numbers to where they need to be. It's humbling and empowering at the same time." But there's another aspect of regular garlic consumption that we need to discuss, and it's one that often surprises people: its potential impact on detoxification. Your body is constantly exposed to toxins from environmental pollutants, processed foods, and even normal metabolic byproducts. Your liver and kidneys work continuously to filter these substances out of your system. Garlic contains sulfur compounds that can support your body's natural detoxification processes. These compounds can enhance the activity of certain liver enzymes responsible for breaking down and eliminating toxins. They may also help protect liver cells from damage caused by toxic substances. This doesn't mean garlic can detoxify your body from heavy metals or cleanse you of toxins in some magical way, despite what you might read online. What it can do is support the organs that naturally perform these functions, potentially helping them work more efficiently. Mr. Roberto Oliveira, a 69-year-old retired factory worker from São Paulo, came to see me with concerns about his liver health. He'd worked in a chemical manufacturing plant for over 30 years, and recent blood tests had shown slightly elevated liver enzymes. Nothing alarming, but enough to warrant monitoring and lifestyle modifications. Roberto was worried that the years of occupational exposure might be catching up with him. We discussed various approaches to support his liver health, including reducing alcohol consumption, which he rarely drank anyway, maintaining a healthy weight, and eating foods that might support liver function. Garlic came up in that conversation, along with other sulfur-rich vegetables like broccoli and Brussels sprouts. Roberto wasn't thrilled about adding more vegetables to his diet. He was a traditional meat and potatoes kind of man, but he was motivated by fear of liver disease. He started adding 1 garlic clove to his meals daily and made other dietary improvements. When we rechecked his liver enzymes 3 months later, they had improved, moving closer to the normal range. 6 months after that, they were completely normal. His hepatologist was pleased with the results and encouraged him to continue whatever he was doing. Roberto's wife later told me that he'd become quite the evangelist for garlic, telling all his friends about his liver improvement. She said he'd even started growing garlic in their small backyard garden, so he'd always have fresh supply. For a man who'd initially resisted dietary changes, he'd become genuinely enthusiastic once he saw measurable results in his lab work. Now, let's discuss something that concerns many of my older patients: immune function and fighting off infections. As we age, our immune system naturally becomes less efficient, a process called immunosenescence. This is why older adults are more susceptible to infections and why vaccines are sometimes less effective in elderly populations. Anything that can help support immune function becomes increasingly important as we get older. Garlic has been used for centuries as a remedy for infections, long before we understood bacteria or viruses. Modern research has started to validate some of this traditional wisdom. The compounds in garlic, particularly allicin and its derivatives, have demonstrated antimicrobial activity against various pathogens in laboratory studies. But more interesting to me as a clinician is garlic's potential to enhance immune cell function. Studies have shown that garlic consumption can influence the activity of various immune cells, including natural killer cells and T cells, both crucial components of your body's defense system. It may also help regulate inflammatory responses, which is important because sometimes the problem isn't that your immune system is too weak, but that it's overreacting inappropriately. Mrs. Isabel Ferreira, a 77-year-old retired seamstress from Recife, used to catch every cold and flu that went around her community center. She was active and social, attending dance classes and card games several times a week, but she'd gotten to the point where she was afraid to go out during winter months because she knew she'd get sick. Each infection would knock her down for weeks, leaving her weak and discouraged. When Isabel came to see me, she was tired of being sick all the time. Her immune system wasn't compromised by any serious condition, her blood work was generally good, but she seemed particularly susceptible to respiratory infections. We talked about various strategies to support her immune health: adequate sleep, stress management, proper nutrition, and staying physically active. I also mentioned that some foods, including garlic, had shown potential immune-supporting properties in research. Isabel decided to make garlic part of her daily routine. She'd mince a clove and mix it into a small amount of honey every morning, a traditional remedy her grandmother had used. She continued her social activities, but also implemented better hand hygiene and got her flu vaccine as recommended. That winter, something remarkable happened. Isabel didn't avoid getting sick entirely. She did catch one mild cold, but it was night and day compared to previous years. Instead of being bedridden for 2 weeks, she had sniffles for a few days and bounced back quickly. She made it through the entire winter season attending her regular activities, something she hadn't done in years. When she came in for her spring checkup, she was beaming. She told me, "Dr. Susan, I don't know if it's the garlic or everything together, but this winter I actually lived my life instead of hiding from it. I danced, I played cards with my friends, I visited my great-grandchildren without fear. Whatever I'm doing, I want to keep doing it." Isabel's experience illustrates something important about health interventions. We often can't isolate a single factor and say definitively that it caused the outcome. But when someone makes positive changes and experiences meaningful improvements in their quality of life, that matters. The scientific evidence suggests garlic could have been contributing to her improved immune resilience, and her lived experience certainly supported that possibility. Before we wrap up, I need to address some practical considerations and potential concerns about consuming garlic daily. First, the smell. Yes, garlic can cause body odor and bad breath. The sulfur compounds are excreted through your lungs and skin, which is why the smell lingers. If this bothers you, consuming garlic with food, especially protein-rich foods, can help minimize the odor. Chewing fresh parsley, mint leaves, or fennel seeds afterward may also help. Some people find that aged garlic extract supplements provide benefits without the social awkwardness, though the research on supplements versus fresh garlic is mixed. Second, garlic can interact with certain medications, particularly blood thinners like warfarin. The anticoagulant properties of garlic, while generally mild, can be additive with prescription blood thinners, potentially increasing bleeding risk. If you're taking any blood-thinning medications, you absolutely must discuss garlic consumption with your doctor before making it a daily habit. Third, some people experience digestive discomfort from raw garlic, especially on an empty stomach. If this happens to you, try consuming it with food, starting with smaller amounts, or lightly cooking it, though this may reduce some of its beneficial compounds. Listen to your body and adjust accordingly. Fourth, while rare, some people are allergic to garlic. If you experience symptoms like skin rash, difficulty breathing, or severe digestive upset after consuming garlic, discontinue use immediately and seek medical attention. Finally, and I cannot stress this enough, garlic is not a replacement for medical treatment. It's a food that may support your health when incorporated into a balanced diet and healthy lifestyle. It's not going to cure serious diseases, replace necessary medications, or compensate for poor overall health habits. Anyone claiming garlic can cure cancer, eliminate the need for diabetes medication, or reverse serious heart disease is being irresponsible and potentially dangerous. So what should you take away from all of this? Garlic is a food with a long history of traditional use and growing scientific support for various health benefits. The mechanisms by which it may support cardiovascular health, immune function, cognitive health, and inflammatory balance are increasingly well understood. The clinical experiences I've shared are real examples of how patients have incorporated garlic into comprehensive health strategies with positive results. If you're considering adding garlic to your daily routine, here's my professional recommendation. Start with 1 clove daily, consumed with food to minimize digestive upset. Crush or chop it and let it sit for about 10 minutes before consuming or cooking to allow alyssine formation. Be consistent. Benefits accumulate over time, not overnight. Pair it with other healthy lifestyle practices, adequate sleep, regular physical activity, stress management, and a balanced diet rich in vegetables, fruits, whole grains, and lean proteins. Monitor how you feel and any changes in your health markers if you have conditions like high cholesterol or blood pressure. If you're on medications or have chronic health conditions, discuss this addition with your healthcare provider first. Be patient and realistic about expectations. And most importantly, view garlic as one tool among many for supporting your health, not a magic bullet that eliminates the need for other healthy behaviors or medical care. The patients I've shared with you today, Helena with her improved cholesterol, Carlos with his resolved toenail fungus, Beatriz with her clearer mind, Antonio with his reduced joint pain, Mariana with her better blood sugar control, Roberto with his improved liver enzymes, and Isabel with her enhanced immune resilience, they all have one thing in common. They didn't rely solely on garlic. They combined it with other positive changes and maintained realistic expectations. But they also gave it time and consistency, and they experienced meaningful improvements in their health and quality of life. Your health is the most valuable asset you have. Small, consistent actions taken today can compound into significant benefits over months and years. A single clove of garlic might seem insignificant, but when consumed daily as part of a health-conscious lifestyle, it represents a commitment to taking care of yourself. And that commitment, reinforced daily, can transform your health trajectory. If you found this information valuable, please share it with someone who might benefit. Leave your questions in the comments. I genuinely enjoy hearing from you and learning what health topics matter most to you. And remember, before making any significant changes to your diet or health routine, especially if you have chronic conditions or take medications, please consult with your healthcare provider. They know your individual situation and can provide personalized guidance. Thank you for watching, and here's to your health and vitality for years to come.